Hello, all. Hope everyone is doing well and had a good weekend. We are now in week 7. uh, Hard to believe, and before we know it, it'll be the fall. So it's hard to believe that this term is almost over. It has absolutely flown by. So hopefully, it hasn't been too painful for you. I always enjoy working with you guys. And hope to see you again soon in the future, but I'm not going to let you go quite yet. We do have a couple weeks here to go. So, week in week 8, just a quick plug, and I'll mention this again at the end. But week 8 is a short week, so don't forget that it is abbreviated. We're done on Friday next week, so be sure. I'm just going to click around here on my other computer for a second. Next week we just have discussion and an ed puzzle. So in one of the discussions, well, we have two discussions. One um, is a regular discussion, and then the other, and actually it's fairly light. In my opinion, I guess. I guess I'll let you make your own opinion. But and the other is really an optional discussion. There's no points assigned, but we really appreciate if you can provide us feedback on what you like, what you don't like in the course. Um, and what things you would like to see added, other topics. I can't speak for everyone, but I do take that information and really use it when I sit down to prep the course for the next time around. And especially with this course, because this is a newer course to me, I am really looking to improve it and make it better for the next time around. So, any thoughts that you have would really be appreciated. If you don't feel comfortable posting up on the discussion board with info, feel free to email me as well with any feedback thoughts that you might have. But that discussion board is optional. There are no, like I said, there are no points assigned, but I really do appreciate your feedback if you would provide some there. But that's week 8. That's next week. Don't mean to jump the gun, but I do want to prepare folks because it does end on Friday next week. I believe the date is the 17th. So we'll rewind back to week 6, which was last week. Our discussion with regard to vulnerable populations, or just like, for example, dealing with health disparities, social determinants of health care. Um, how can we help vulnerable populations from a policy perspective, and dealing with um, equity of care, access to care, cost of care, quality of care, all of these different things. How can we do that? Um, and how does that how do we do that as opposed to our colleagues in other countries? And I think that you've probably heard it a million times, especially if you did if your bachelor's degree was in a healthcare related field, or if you work in the healthcare setting, and then obviously already in your work in this program, you've already heard a million times that based on GDP, we spend ridiculously large amounts more than our colleagues in other countries per capita, yet our outcomes are not as good as the others in those, in the Western world. So why is that? And now, as we begin to look um, at social determinants of health a little more in a little more detailed fashion, can that be part of the reason? Have we not spent as much time focusing on these vulnerable populations? Have we focused more on those that make money for our system? And could that be part of the reason why our outcomes are not as good? And I'm not saying that that is, but could it be? Do other countries provide better care for those that don't have cash to pay, or insurance to pay, which most countries have single payer, so it's not, or some other system that allows for coverage across the spectrum. And so, can that be part of the issue? And that doesn't mean that countries that have insurance across the spectrum, they still have issues with social determinants of health. It's not limited to folks with insurance. There are plenty of folks that have great health insurance in this country that are still facing issues with um, with with poor poor home settings, poor diet based on inability to get food in their areas, uh, just poor access to care because of where they live and maybe they don't have a vehicle. So it's not that these social determinants are still in place for people that have great health insurance here, and they're still in place for people who have great health insurance or great access to care, not necessarily access to coverage in other countries as well. But are they doing a better job than we are in dealing with these vulnerable populations? And so that's what we took a little look at this week. And there are some differences. There are some countries that do better than we do, and there are some countries that we do better than they do. So it's interesting to take a look at it. And then, how can it gives us kind of a starting point as to how we might be able to improve our operations. Now, and I get this comment, this is one of the comments I get sometimes. Well, a lot of this is public health. Why are we looking at so many of these things? Well, 20 years ago, these used to be public health issues, but they're not anymore. This was what the public health sector worked on 20 years ago, and the traditional healthcare sector worked on taking care of sick people. But that's not the case anymore. They've merged. There's really, the healthcare leader of today needs to not just worry about the patient coming in with an MI. They need to worry about what are they going to go home to? Are they going to have care? Are they going to be able to get food? Is there going to be transportation? They need to worry about all of those things now. So it's really so much more broad than just are they coming in for an MI? So just a little social commentary there, I guess, but important to keep in mind that public health, which usually dealt with more of those population issues and social determinant type issues, and the traditional healthcare sector, which in the past always dealt with sick people and maybe doing some wellness care, they've really merged, and I think it's for the better, personally. So we talked about vulnerable populations this week, and I'm going to put in a little plug, or this past week. I'm going to put in a little plug for this coming week. This coming week, we're going to do some policy analysis. And policy analysis is really taking a policy issue, and this is your final project. You're going to take a policy issue, and you're going to kind of break it down, look at what policy exists on this topic, give some additional analysis of that, and kind of where we can go with perhaps additional policy, etc. Now, that's a very bare bones look at policy analysis, but there is a document in there. Now, the document that's in there is for hardcore policy analysis. I'm not expecting you to do that, but I thought it would be, you can do that if you want, but you don't need to do that. But I thought it would give you a good idea of what policy analysts will do when they sit down to do policy analysis. To look at, here's the topic. Okay, we want to try and address binge drinking in college students. So we want to see, we want to deal with binge drinking in college students in, in a certain area. So they're going to look at, okay, from a policy perspective, we know that it's illegal if they're under 21, so we'll detail that. They might pull data on police reports. They might, they're going to look at all these different things, and then they're going to look at maybe trainings that have been done and in those colleges in that area. It'll be a very data-driven process, and I really encourage you to look at data, to look at research, to look at scholarly journals. Look at, some of you are really just providing a lot of opinion, and an opinion is great, but there's a saying about opinions. I'm sure a lot of you know the saying. I will defer from saying it, but everybody has an opinion, and unfortunately, our opinion won't get us very far in the professional setting. So we need to back up our opinion with data, or with research. So, so our opinion is lovely as long as it's backed up with research or with data in some way. So make sure that you have some information. You know, you'll have an issue, a topic, you'll have some research to say, okay, here's what's been done, and then you'll give an opinion. Okay, here's what I think needs to be done additionally. Maybe some additional, they've already done training, let's do additional training. They have this policy on campus, they need to do these additional policies on campus. Those types of things. Now that's a very low-level policy because that would be an administrative policy maybe on a campus, but to expand that to a more broad, true policy level type issue, I think is where you want to go. And perhaps you looked at a topic in your vulnerable population discussion from last week that might be something that you would be interested in. Or maybe, what was our, the health disparity brief that you wrote? Maybe that was something that would be something you would be interested in, that topic. Maybe there was something in that that could give you some additional information. And definitely those reports that you looked at last week, that site, there's a lot of data there. So, so those are some good resources for you. Okay, enough yammering. I do a lot of yammering. You've definitely figured that out by now, I'm sure. Okay, sorry, small malfunction there. Let's get back to the, there we go. Okay, so let's go over the quiz questions. So first one, which of the following was among the political barriers that delayed the enactment of the Medicare program? So there was a discussion in the text about the process of the enactment of the Medicare program and or actually the whole process of the Medicare program. And it talked in there about actually from the 30s all the way up to the 60s when it was enacted, how there was a committee that was put in place. And I think that question is what led a few of you astray. There's a committee that was put in place and the committee, and this was back in the 30s, the committee was for the program, but the AMA, the American Medical Association, was a huge lobby against the program. They were completely against the Medicare program, and they were against the Medicare program all the way up to the time it was implemented, really, from the 30s all the way up to the 60s. So our correct answer for which of the following was among the political barriers that delayed the enactment of the Medicare program was that the American Medical Association, or the AMA, was against a Medicare program at that time for a 30-year stretch. I'd be willing to bet that there's probably some AMA members that are against the Medicare program. If you ask them, there are certainly always some physicians that are against any entitlement program. A lot of them are not huge fans. So the second question, the principal limitation of policy demonstration projects is that they what? And this was a multiple choice question as well. I won't read through all the answers, but the correct answer was that they cannot prove a causative link between the policy and the desired outcome. And so the big thing with demonstration projects is that they are just that. It's a demonstration. It's very small sample size, and they simply they put out this this project, and they say, okay, people sign up, do this project, and we'll see what the outcome is. Well, with a policy, if we have a policy for something, it's going to be applied to everybody, not just those that want to do it. And then we're going to see, okay, we apply this policy to the population, and then we're going to find what the outcome is. So we already have a biased population when we're only getting those people that want to do it. So that's one problem with it. And then because, I mean, they're not tiny sample size, they would only ever do a pilot project with a statistically significant sample size, but they're still kind of small to have an overall causative link, to have that demonstrated. But so in any case, we really can't have a causative link between a policy and an outcome because we don't have a policy at that point. We don't have something that's being applied to an entire population, whichever it happens to be, maybe all physician practices, maybe all patients, maybe all hospitals, etc. Because we don't have that, we're really unable to prove anything until we apply it to an overall population. However, demonstration projects are great to provide additional information about how something might work. Like, for example, the Pioneer ACO project, which was the first accountable care organizations when they first came out, that told us a lot about how to do things, how not to do things. They were really helpful. The one thing that I think back of actually worked out really well for me because I got a lot of consulting work about it. But for those of you that do work currently in the healthcare setting, you may remember the RAC audits, or the Recovery Audit Contractors. There were a series of, they're still around, at least last I knew they were still around. I think they are. I obviously haven't been doing consulting or compliance work in a short bit, but when they first had pilot RAC audits, New York was one of the states they chose because it's a large state, and they were just doing really bad things, really taking massive amounts of money from providers, using data-driven auditing and whatnot. And it worked out well for consultants like me because I was able to go in and work with providers to help them get their money back when they had poor auditing done by these RAC contractors. So it worked out well for me, not so well for the providers initially. Most of these providers were able to get their money back. However, what they were able to do, what CMS was able to do from these pilots, was see what was done wrong by the original contractor and fix that for the final program that was implemented. So they are able to use pilots as kind of like guinea pig programs to determine, okay, here's what I did wrong and here's how I fix it for the future. So that's really what, it's not so much about cause and effect in demonstration projects like that or pilots. It's really more about, sorry, my phone is ringing. It's really more about how do we move this forward and make changes for the final plan. Okay, last question. In which components of policymaking is policy modification most likely to occur? And I'll apologize in advance. I know that this is kind of a tricky question. So the answer to this was B and C. So it was the answers were evaluating, legislation development, and rulemaking. So B and C would have been legislation development and rulemaking. So those last two there were B and C, and our answer was B and C. Now, could policy modification occur across any of them? Yes. But when is it most likely to occur? During legislation development and rulemaking. It's less likely to occur during the evaluation process, and this is laid out in the textbook. If you want details on where it is, let me know. But it's less likely to occur during that evaluation process, and actually it's much more difficult at that point. But during the legislation development and the rulemaking process, it's much easier for the changes, modifications to occur during that time. Okay, so with that, I will let you go for the week. I will see you in the boards and in dealing with any questions that you might have. If you have any questions on that final project, please let me know. And again, remember week 8 next week is a little bit shorter week. Also, be sure, I know that we normally just run term to term to term to term, but I believe we have a tiny break between this term and our August start. It doesn't seem like we've had that in the past, so I'm not sure what happened, but it's lovely. We have a little bit of a breather before our fall term. So enjoy the rest of your summer. Summer time here, week and a half, I guess, or so, 2 weeks, and I will see you around this week. Okay, thanks so much.